Let me ask you first, though, as a private health insurer, we'll have always the discussion about a Bürgerversicherung, so an insurance for everybody. Is that something that you believe is good from a patient perspective? Is it good from an insurance perspective? And also, where do you see digitization helping you in the future and helping the Allianz Health Insurance?
I'm not a politician anymore.
Yeah.
I'm a member of a Free Democratic Party, but I'm not as profession. I'm not a politician. So let me answer your question. The difficult question is, what is a Bürgerversicherung? What is the concept? I hear in every campaign, every 4 years, I see ideas, but there is no fundamental, or no, there is no real concept for an act to introduce such a, at the end, a single-payer system in Germany. I would say a single-payer system in Germany would not be accepted. I think it would not solve any problem we were faced here in Germany. So to make it short, I would say there is no chance, and even the parties were together and decided in this legislation period there will not be a concept for a single-payer system. From my perspective, competition is the right way. Of course, healthcare is not a free market like other markets, other branches are, but we need more competition in the system than we have at this stage. So I would say even competition between the insurers, even between a public and a private system, would be helpful for people, for providers, for patients, for insured persons, to compare the offerings and to compare what is the right package, what they need. So my perspective is, when I look in other countries where there is introduced a single-payer system, they don't have better results. As you introduced that you don't think that we are the best country for innovations. I don't agree. I fundamentally would disagree, because we have an open market for new products, for pharmaceutical products, for medicinal products. We have an open market for new treatments, like I would say no other country in the world would have. Because you don't have, if you have a new product, you could enter the German market and would have in a very fast way access to the whole system. For example, pharmaceutical product, medicinal product, if it is allowed to sell in the German market, it would be reimbursed by the public and the private system immediately, which is not the stage, which is not the situation in any other countries. And even the digital health applications, I don't know the right English word, the DiGAs, we call it in Germany, they are also an example for a real fast way for innovations to enter the market. But of course, every innovation should not only have a fast access to enter the market. Of course, the success is not only the fast access, the success of a product is, of course, if it convinces enough persons to use that product. And that's the question we are faced now for the digital applications, for the digital offerings, if we convince enough people. My example, when I started at Allianz, it was in 1 year after I left the government. It was end of 2014. And one of my first decisions at Allianz Private Health Insurance was to offer an app to our customers. We were the first insurance company in Germany who offered an app to send the bill via an app to get the reimbursement. We were the first health insurer, but at 2020, last year, it was the first time that more of our customers sent the bill to get the reimbursement via app than via post. So it takes a long time to convince customers, to convince people to use digital application. What's the reason for that? When I look here in the auditorium, I see a lot of young, very successful and very sexy people, digital natives, yeah? But the customers of a health insurance company, of a sickness fund and of a private health insurance company who ask or demand for care, they are not young, sexy and successful at the most side of the page. So the problem is to attract people, to convince people to use this digital offers, to use these digital apps and so on. So that's the problem we are still faced even in 2021.
Well, I think maybe